Today, there's a growing movement of people using technology to support us in dealing with these challenges. Tech solutions can be low cost, easy to use and pervasive. We can get care anonymously, when we need it, or even before we realise we need it.
When I was 14 and first went to my GP, it had been a long struggle to get there. I'd probably been symptomatic since early childhood, but not really known what was wrong with me. And partly that's because we don't talk about mental health at school. We don't teach young people about their feelings and looking after themselves and each other.
Kat and Fiona have both used technology to support their mental health for many years. And it seems they are not alone. There are an increasing number of apps available that allow people to record their daily mood and actions.
I think tech is being used in lots of very creative ways in mental health, and I also think that actually we're right at the beginning of technology having its full impact in health and well-being. Now, you've got mindfulness training online, you've got CBT training online, you've got Twitter, blogging, vlogging. There's so many different mediums where people are learning to express themselves. People are actually using, I guess, a modern version of keeping a diary, reflective practice.
I think the types of patients that it's beneficial for are those who have relatively mild levels of distress, which shows up as anxiety or depression. There are a lot of patients who have mild symptoms of anxiety and depression, lots and lots.
Kat uses Buddy, which is an app therapists use with patients to help track their mood and stay in touch between sessions.
Buddy is given to people that already have a therapist, and I find it really actually helps you to cement that relationship with a patient or a clinician. You kind of carry on your everyday life and you run around, and then you remember that you've got a therapy session, but you can't remember what you've done the day or the week before, and it's hard to put into words what you feel you need to talk about. So every day I get a message from Buddy asking me how I've been doing and to rate my day from 1 to 5 and tell Buddy a bit about what I've been doing. If I'm really anxious every Monday, maybe it's because I'm drinking 3 cups of coffee, and maybe a goal for me is to cut down.
Buddy, I think, is fantastic because I think it helps the relationship develop between the person who needs help and the person offering it. It's not an alternative. You're not asking people to work on their own. It's supplementing what clinicians, therapists do, and hopefully making it more meaningful for the patient, the person who's presenting, and for the clinician in their work. Practical reality is we know that we've got far more people who have mental health issues than there are services to meet their needs. The NHS is not used to working like this. The professionals who offer help now were trained at a time in the main when these weren't mainstream things. And even though the professionals now will be doing online banking, booking their holidays, all the things that everybody does, they're somehow or other resistant. And as I say, that's something in other parts of what I do. We're working to how we can help people change and see this not as a threat to what they do, because it's not an alternative to traditional therapy. What it is something that can either enhance therapy or offer therapy to people who would never get near it because there are so many people looking for it.
Kat now works for Buddy app and speaks frequently about the use of technology in supporting mental health.
A lot of the time NHS services are very 9 to 5, and actually most people don't have a crisis during office hours. It's the evenings and weekends when they struggle. So for me, being able to go online at 4 AM when I couldn't sleep and hadn't slept for days and talk to someone, even if they were in Australia and it was breakfast for them, was really powerful for me because it meant there was always someone there to talk to. What I would love to see maybe in 5-10 years is digital being business as usual. It not being seen as some incredible revolutionary thing. I mean, if you think about it, the text message is 25 years old, so it's as old as I am, and it's not really that revolutionary. So what I would like to see is more digital services, not replacing what's already there, but complementing what it's doing. And what would really help me as a patient is if I could actually Skype a GP after work, you know, in the comfort of my own home at 7 p.m, say, or be able to send an email to a clinician asking for something or some piece of advice instead of having to write a letter or physically see them.